Today we are going to talk about Pap smear and its importance in preventing cervical cancer. This is a normal female genital tract comprising of the organs uterus, ovaries, fallopian tubes, cervix, vagina, and the vulva. What is the importance of Pap smear? Pap smear is a screening test done to prevent cervical cancer, which is caused by human papillomavirus, mainly HPV 16 and 18. When one should undergo a Pap smear, the ideal age is between 25 years to 64 years. Who, when for Pap? Screening tests can find the abnormal cells which can be treated before they turn into a cancer. The only cancer the Pap test screens for is cervical. HPV is the main cause for carcinoma cervix. Most women don't need a Pap test every year. But when you are at your 21, you should get your first Pap test done. If your test results are normal, you can wait for 3 years for your repeat. HPV tests aren't recommended for screening women who are under 30. When you turn 30, you have a choice. If your test results are normal, either you can take a Pap test every 3 years or get both the Pap test and the HPV test every 5 years. When one woman should stop getting screened? When you're older than 65 and have had a normal Pap test, or when your cervix was removed during surgery for non-cancerous conditions like fibroids, adenomyosis. Pap smear is an inexpensive and a painless procedure which is done as an outpatient department procedure. Every woman of reproductive age group should undergo a Pap smear to prevent cancer cervix. How to do a Pap smear? We have to make sure that the patient lies on the back and place the feet on the footrest. Now the doctor will insert a speculum into the vagina to hold the vaginal wall open. They will quickly brush along and a thin swab over the cervix to take the cell sample, which will be made into a smear on the slide and sent to the laboratory in a coupling jar which will be filled with alcohol. Quick facts about cervical cancer. It is the second most common cancer affecting the women. Cervical cancer is caused by a common virus known as human papillomavirus. Every year, about 500,000 women worldwide are diagnosed with cervical cancer. Early sexual experience increases the risk for cervical cancer. Sexually transmitted infections like chlamydia, herpes may cause cervical cancer. Usage of contraceptives is a risk factor for cervical cancer. Women who smoke are 2 times more at risk than the non-smokers. High number of pregnancies increases the risk. Regular Pap smear test decreases a woman's chance of developing cervical cancer by 5 times. The main cause for cervical cancer is this culprit here, human papillomavirus. The 4 most important types of HPV are HPV 16, HPV 18, which causes cervical cancer in 83.2%, and 50% of vaginal and vulvar cancer. HPV-6 and HPV-11 causes anogenital warts in 90% of the cases. Now, the Pap cytology, which will be examined by the pathologist in the laboratory under a microscope. On the right hand side, we can see the normal cervix, low-grade CIN, high-grade CIN, and the frank carcinoma. Apart from cervical cancer, what else a Pap smear can detect? It detects microorganisms like Candida, bacterial vaginosis, Trichomonas vaginalis, herpes simplex virus, cytomegalovirus, actinomyces, leptothrix, etc. HPV vaccination. Yes, HPV vaccination prevents carcinoma cervix. HPV vaccine targets the HPV types 16, 18, 6, and 11. The vaccine is 99% effective. The first dose has to be given to the girls aged between 12 to 13 years. The second dose can be given 6 to 12 months apart. Don't shy away. Get your Pap smear done right away and prevent from cervical cancer. Thank you.